COVID-19 has generally spared the physical health of young people. The CDC says kids account for less than 10% of all cases in the United States. But the pandemic has preyed on their mental health.
Uncertainty, death, social isolation, parental angst, and all of this has majorly impacted children and adolescent mental health.
Is it one of your more challenging days?
Christina Samabomarito is the school psychologist at the Mary Lewis Academy. Over the last year, the number of students she counsels has gone up by 50%. She says teachers have taken on a new critical role in identifying students who need help and guiding them in how to control their anxiety.
What students may need in the moment may not necessarily be part of the lesson plan.
Students say the uncertainty of the pandemic has been the biggest hurdle.
It was hard those months when we were majorly isolated and we weren't going anywhere, and it was hard to stay in contact with my friends.
Lately, Gabriela Maldonado has been putting mental health first.
Taking deep breaths. Sometimes I'll just get up, take a break from whatever I may be doing, and I'll go and splash some water on my face. It kind of reawakens me and brings me back to the task at hand.
But what happens when depression and anxiety are so intense? Tips and tricks don't cut it. According to the American Journal of Pediatrics, suicidal ideations in people ages 11 to 21 went up during months when COVID-related stress was at a high.
Teenage years, as we know, are stressful in and of themselves. To add this has been so detrimental to so many kids.
Chris Dougherty, the school social worker at Archbishop MOLLOY High School, sees nearly 40 students a week. But it's been tough to talk to them about important mental health issues like suicide.
Tracking them down has become harder. Forgetting about the appointment, so I've had to remind them to set notifications and reminders.
Simple things like laughing can relieve stress and anxiety. But students say it's most important to ask for help.
When I just feel scared or anxious or any sort of paranoia, just knowing that I have God and I can have faith and hope in Him, it really just keeps me grounded.
Though physical distance is necessary, experts say now is the time for kids to stay socially connected. In Jamaica Estates, Jessica Easthope, Currents News.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and click on the bell to get updates to all of our newest content, because we are putting your faith in the news.